Good morning, everyone. Good morning. So this is a horrendous room, and our apologies to the people who are behind the concrete back there watching on a screen. But this committee was organized in a very short time frame, and its work is actually going on in a very rapid pace, and therefore this turns out to be the only room large enough in the Academies complex that was able to accommodate us. So I apologize for the split thing, but it was unavoidable. Hopefully everybody can hear, and hopefully everyone will be able to see the slides on the screens that are around us. So let me start by welcoming everybody to a public workshop of the Committee on Medication-Assisted Treatment for Opioid Use Disorder, and that's our official name. I promise you we'll surely have some different title for the eventual report of the committee. And we are basically looking at the state of the art. What do we know and what do we not know about medication treatment for opioid addiction? And in order to make sure that we've accumulated the expertise we need in addition to the members of the committee, we in fact decided to hold this public workshop and listen to experts, which hopefully that's what we've done, is collect experts. I have to read this formal thing, and it's out of character for me, for those who know me, but I'm Alan Leshner. I'm the chair of the committee. I am unemployed, but I used to be at the American Association for the Advancement of Science and Science Magazine, and I used to be the director of the National Institute on Drug Abuse. That's my only credibility on the issue. So let me read this, and then we'll proceed. As chair of the committee on I would like to welcome everyone to the open session of the committee's first meeting. This is an open, on-the-record information gathering session. As part of the process, the committee collects information and materials to consider and discuss as it makes its findings, conclusions, and recommendations. Therefore, I ask everyone to be mindful of the fact that the committee has made no conclusions about anything yet. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or the National Academies of Sciences, Engineering, and Medicine. About the study process and the timeline. For those of you not familiar with the committee process, this is the first of two planned in-person committee meetings. Based on a review of the literature and input from the workshop, the committee will draft a report with findings and conclusions to be released in March 2019. Before the draft report is released to the public, it will go through a rigorous review by experts who are anonymous to the committee, and the committee must respond to this review with appropriate revisions that adequately satisfy the Academy's Report Review Committee and the chair of the National Research Council before it's considered an Academy's report. The public workshop today provides an opportunity for the committee to hear from a broad range of individuals with expertise and experience in medication-assisted treatment for opioid use disorder, so the committee can benefit from the wealth of knowledge and experience of diverse stakeholders. We want to thank the sponsors, the National Institute on Drug Abuse, Substance Abuse and Mental Health Service Administration, and the National Institutes of Health. That's the official opening. You have now been officially opened. So we have an extremely full day. we are tremendously grateful to people who have rearranged their schedules in order to be here and be a part of this. I should tell you that the committee is here for a 3.5-day marathon, which is probably the longest committee meeting in the history of the academies, and it is extremely intense. So we're all very grateful to the committee as well. Just for people who are going to be speakers, if I could tell you the ground rules, there are little lights here up on this podium. Green means keep talking. Yellow means you have 2 minutes left. Red means please stop now. Because the schedule is so tight, we are asking people to stick with it. When that red light goes on, please stop speaking. Otherwise, an unnamed person sitting in that corner who looks like me may get up and do something rude. But in order to get through and make sure that we hear from everyone and give everybody an opportunity to express their views, and for us to have the opportunity to hear from them, we're going to be rather rigid. The format that we'll use is that members of the committee will be moderating various sessions, and that will provide some variability, and in each session there is a panel of experts who's going to be speaking. So before we're going to get greeted by Dr. Victor Dzau, the president of the National Academy of Medicine, who wasn't able to be here today. That's him. And we will make him speak in just 1 minute. The entire Academy's leadership has been tremendously interested in this project and the other projects that the Academies are involved in. In fact, I think Dr. Dzau will speak about some of the particular activities of that Academy. Let me take 1 quick minute just so everybody knows who is on the committee. I'll ask the committee to run around rapidly and say their name and what their job is, and then people in the audience will have a better sense of who we are. Kathy.
Kathleen Carroll, Yale University School of Medicine.
Walter Ginter, National Alliance for Medication-Assisted Recovery Mars Project.
Colleen Berry, Johns Hopkins Bloomberg School of Public Health.
Tracy Green, Brown University and Boston University.
Huda Akil, University of Michigan.
Sean Ross, American Nurses Association.
Dave Lahav, Yale University.
Yasmin Hurd, the Icahn School of Medicine at Mount Sinai.
Scott Steiger, University of California, San Francisco School of Medicine.
Shinazo Cunningham, Albert Einstein College of Medicine and Montefiore Medical Center.
Laura Lander, West Virginia University, Department of Behavioral Medicine and Psychiatry.
David Patterson, Silverwolf, Washington University in St. Louis.
And let me just take a quick minute, introduce Michelle Mancher, who is from the staff of the National Academies, and she is, in fact, the study director, and her colleague, Claire Stroud, who's also a member of the staff, and I can tell you from my experience so far, they are fabulous. So therefore, we are, to start with, grateful to them for their work. Okay, with that, let me give you Dr. Dzau, and then I'll introduce the panel.
Hi, I'm Victor Dzau, the president of the National Academy of Medicine. I'm so pleased to welcome you today to this public workshop, which is part of the Consensus Study Committee to study medication-assisted therapy or treatment on opioid use disorder. I'm only sorry I can't be with you today because I know it's going to be a terrific workshop with lots of great discussions and dialogue. Now, the importance and timeliness of this study cannot be underscored enough. The opioid epidemic is the deadliest addiction crisis of our time. It's ravaging individuals, families, and communities across the country, and will have a long-lasting effect on generations to come. Drug overdose is currently the leading cause of accidental death in the United States, and according to CDC, estimated 115 Americans die every day from an opioid overdose. Over the last couple of years, communities, organizations, industry, and all levels of government across the nation, everybody has sprung into action to try to tackle this epidemic. For example, early this year, a record $4.6 billion was appropriated in the federal government to fight this crisis. Just 3 weeks ago, Congress passed a bipartisan consensus bill which combines some 58 bills, which is the most largest legislative Congress taken to address this crisis. And President Trump just
That's sort of interesting. So you'll notice he must be from the National Academy of Medicine, not of Engineering, or they'd be able to make it work. So, sort of interesting. I think it's loading. Is there an engineer in the room? No. Yeah, you may have to start it again.
Hi, I'm Victor Dzau. Some 58 bills, which is the most largest legislative Congress taken to address this crisis. And President Trump just signed this into action on October 24th. So this is an important step in the right direction. But we have a long way to go from bills to action, from laws to activities, and do what's needed to address a very complex and multifactorial crisis. So for today's workshop, I'll focus on the use of medication-assisted therapy, MAT, for opioid use disorder. As you all know too well, we continue to treat opioid use disorders. In 2014, only 25% of opioid admissions to specialty treatment had treatment plans that involve medication. And while recent studies indicate some improvement, it's still estimated between 70 to 80% of people with an opioid addiction are not getting treatment. Where MAT is offered, we continue to fall short of the President's Commission standard recommended that all modes of MAT be offered at every licensed MAT facility. Access to MAT is further made difficult by insufficient incentive and reimbursement options for providers, insufficient integration of non-medical services such as counseling, housing, income assistance that are essential to long-term recovery and success, and of course the persistent and pervasive stigma that surrounds addiction. This is why we have brought this consensus committee, which should conduct a study of the evidence based on MAT for this disorder. The committee is holding today's workshop to hear from individuals with relevant experience and expertise in the evidence based on MAT, the barriers and opportunities to improving access to MAT, and patient community perspective. So I want to thank both NIDA and SAMHSA for their leadership in prioritizing this effort and for their sponsorship. In addition to MAT, addressing the opioid epidemic requires a multi-pronged approach. A major barrier to the efforts is the fragmentation of efforts and the lack of coordination and collective action. Given the complexity of the issue, the solutions have to be multi-sectoral and collective. No single agency or entity can do it alone. This is why we formed the NAM Opioid Action Collaborative, to use our convening power to bring together stakeholders to galvanize collective action. The Action Collaborative is truly a unique public-private partnership because it brings together major stakeholders to collectively develop coordinated, focused efforts to tackle the epidemic. More than 35 organizations, including all agencies of HHS, state and local officials, healthcare providers, education accreditation, pharmacy, and academia have come together to form this partnership. Our collaborators, co-chaired by Admiral Brad Ewart, Assistant Secretary for Health and Senior Advisor for Mental Health and Opioid Policy in HHS, as well as by Ruth Katz of Aspen Institute and Jonathan Perlin of HCA Healthcare. Collaborators have been working very hard the last several months in addressing the following areas. First, establishing a coordinated education continuum, from undergraduate education to graduate, continuing medical education, nurses, dentistry, along with accreditation and human licensing. We also assisted the FDA in defining opioid prescription guidelines for a range of indications and ensuring these guidelines successfully translated into workflow. Furthermore, the collaborators are addressing more effective treatment and prevention, as is being done in this study. And then finally, research and data. You know, the collaborator serves an umbrella activity for all opioid efforts going across the academies, including this MAT study and 4 other studies and 2 workshops, which are shown in this slide. The consent study includes evidence-based guideline for acute pain, review of specific programs in Comprehensive Addiction and Recovery Act, or CARA, development of a protocol to evaluate the use of opioid and benzodiazepine medications and the veteran death and suicide, and examine the integration of opioid and infectious disease prevention efforts. And there's 2 workshops which are shown in this slide. I won't have time to go over them. So, there's great opportunity to work strategically across the academies on this important issue, using collaborative as a linkage and synthesizer. And collaborative can be a resource to the consensus committees, such as, to this case, the MAT study committee. In conclusion, the Academy is truly committed to doing whatever we can to help address the opioid epidemic. Of course, all your work make our work possible. So, on behalf of NAM and other academies, my sincere appreciation and thanks for your participation today, and for being a big part of this critical effort. All the best and a terrific workshop and meeting, and I look forward to continue working together with you. Thank you.
Thank you, Dr. Dzau. So one more moment on process, and then we'll get started. So the way it'll work is that different members of the committee will, in fact, moderate the different sessions and do it with an iron hand. And then hopefully we'll have sufficient time for the committee to ask questions of the speakers and the panelists. The committee will get priority. That is to say, if they run out of any questions and we still have a little bit of time left, we will open it up to the audience. But if there isn't, it will be restricted to the committee, because the real purpose here is for the committee to gather the information from the experts, obviously. Each of the moderators will sit in their respective seats so that they don't get in the way of the speakers.